Good afternoon. My name is Paul Lilley, and I'm a CIT trainer in Northwest Ohio. And we're going to talk about de-escalating adolescents. I want to start by asking you a question. Who is this? Who is someone that often acts without regard to consequences, impulsive, moody, a risk taker, thinks they're invincible, self-centered, interested in seeking gratification, live in the here and now, don't plan, don't organize, easily irrational and emotional? This sounds like it could be the DSM criteria for a whole host, a range of personality disorders. But frankly, it's adolescence. Or it's kids. We're going to talk a little bit about brain development. We'll focus mostly on adolescence, but the fact that the brain isn't done yet creates this whole list of impulsivity and mood taking and risk taking. Anyone that's a parent of 14, 15, 16-year-olds kind of understands this spectrum. So I want to start by kind of normalizing this behavior when we're talking about adolescence. Part of what keeps adolescence and the guardrails for adolescence is parents and caring adults. So the guardrails for parents to handle this is limits and consequences, in a word, parenting. However, sometimes even with the parenting, their lives may be chaotic. They may have been traumatized, and you can mix in a whole host of medical or psychiatric disorders, alcohol and drug use, even poverty. All of those can play on a parent's ability to successfully parent their adolescent. So with adolescents, they bite off more than they can chew. I mean, they're just wired to do that as risk takers, as someone that lives in the here and now. Planning is not something that is a real strong skill. You feel invincible, and so you bite off more than you could chew. The guardrails for adolescence then are parents, positive adult role models, structure, belongingness. It's a sense of community. That's what helps keep all this adolescent behavior, if left to itself, in check. And we know that poverty, trauma, parental chaos, isolation, AOD, alcohol and drugs, whole host of other things can derail that. The brain development for adolescents, the teenage brain generates more intense impulses. The teenage brain is immature frontal lobe. Of course, that's the part that organizes behaviors and controls impulses. It's the slowest part to develop in the adolescent brain. It also affects their contingency thinking and the near future. That's why they're in the here and now and not so much farsighted. Also, with the brain development of adolescents, the underdeveloped portion is the restraining system, one of the last portions to develop in the brain. That's the one that deals with safety, consequences, rules, order. That's the part of the brain, again, that helps check adolescent behavior. The hormonal growth spurts with adolescents, too, obviously are very different. Anyone that has adolescent boys or girls, parents them, know that. Adolescence is characterized with at-risk behaviors, and that could be anything from drug taking to driving fast to sex, aggression. Some of that has a chemical component to it as well. And juveniles learn to some extent by testing limits. That's how we all learn. And again, that's why the parental guardrails, when we have strong parenting, helps deal with some of that testing. I want to talk a little bit about juvenile aggression, because then I want to bring it down to actually encounters with adolescents, with law enforcement. Juvenile aggression is different. In an earlier block of training, we talked about the de-escalation skill set being patience and empathy. That will still apply. We also talked about the de-escalation survival skill of vigilance. That will also apply. But I want to talk a little bit about the difference between juvenile aggression and adult aggression. Youth have 4 needs that they're trying to fulfill through adolescence: love and belonging, power and importance, fun and pleasure, and freedom and choice. With adult aggression, it's often deliberate, more controllable, more responsive to external commands to stop. With youth aggression, it's very emotional and often springs when it's frustrated, when one of these four needs get frustrated. Adolescent aggression, grounded in emotions, therefore could be very unpredictable. And you could see the mood swings very quickly. You could have an adolescent who's very, very angry and then is able to calm down really quickly. So the emotional side of that is what I want to highlight for officers that are de-escalating juvenile aggression. Something that is making the rounds more in mental health treatment settings is adolescents that are cutting. And I just want to briefly touch, I want to talk to this differently than suicide. When we have adolescents that have a history of cutting themselves, we certainly teach it's a cry for help, but it's a little different than suicide. They're not trying to kill themselves with the cutting. It is a call and a cry for attention, but they're seeking to injure themselves in a way that seeks some sort of psychological pain. The fact that they could feel this is comforting to them and reassuring to them. So again, they're not trying to kill themselves. The pain they're making and causing themselves to feel is easing them psychologically. When you're in an encounter, what we tell officers to look for is if it's summer and there's long sleeves or football jerseys or hoodies. Often that's to maybe hide anything from needle marks to history of cutting. And so in the assessment phase with officers, we tell them to be very aware of that. But the cutting, it's not even necessarily done to retaliate against others. They're not mad at mom for punishing them, so they're going to cut themselves. It's more wrapped up into that first bullet, which is they seek to injure themselves to ease the psychological pain. More often than not, there's always exceptions, but more often than not, it's female adolescents that are doing this. So, things to consider when we're de-escalating juvenile aggression. Family and the environment play a big role in an officer that is called to the home to de-escalate an adolescence. Whether you de-escalate in front of the parents or outside of the parents' view will depend on what you're walking into. Just know that the presence of parents can work with you as you're trying to de-escalate, or if that's the source of part of the conflict, can really work against you. So you'll need to make a pretty early premeditated decision on if you're going to separate the adolescents. Also the power of their peers. If you're trying to de-escalate one youth in front of their friends, very, very difficult. Again, so much of the youth's identity comes from family and peers. So much of that influence comes from family and peers. And as we've already established, a lot of the acting out is very emotionally rooted, not logically rooted. So again, like with families, if you're trying to de-escalate in front of peers, it may be wise to separate them and try and get the adolescent alone. The emotional aggression and power struggles with adolescents, as parents can tell you, that seems to be what a lot of that is about, is the power struggles. And you don't have to get into the power struggles with the adolescents. You're the authority figure. Some of the skills we talked about, forecasting and leading to the resolution you need, you can employ here. It is a good technique, though, to explain to them what you want. It's really important for adolescents to get reasons. It's probably important for adults as well. But as you're seeking compliance with adolescents, telling them what you need from them and why you need it from them is a good de-escalation strategy. Also, again, forecasting, letting them know what will happen, both if they're compliant and non-compliant, letting them know what would happen. So we're going to break down a typical encounter with an adolescent, if there is such a thing, into the 3 steps of engage, assess, resolve. Generally, again, the block on de-escalation, patience, empathy, vigilance, all that applies. These are special things, though, to consider when we're de-escalating adolescents. You're still using your communication web that we talked about earlier. You're listening and clarifying in the engagement stage. You're seeking through the assessment phase to understand what's going on. Again, you're still a cop, so you're ruling out if there's other things going on there. And then you're going to decide on the course of action you need to resolve it. And again, we've talked about the building block, the foundation for your de-escalation skills is that empathy it's patience, it's vigilance, you're the professional, it's compassion. So in the engagement phase, we talked about the need to separate them, even maybe from parents as well as peers, if you're trying to get assessment information and it's not working. A lot of times kids will de-escalate almost quickly once you separate them from the peers. Try not to judge the adolescent quickly. I showed you a picture several slides back of a tattooed with rings in the tongue and the ears, and kids are pretty adept at knowing when they're being judged. So you'll have to be really careful if you have biases that way, not to judge their dress, their speech, the way they talk. Do a lot of reflective listening. Adolescents generally will talk. They will let you know the source of their anxiety. But remember, it's emotional. What we don't want you to do is trying to get into a logical discussion with them about consequences necessarily and your behavior and did you really think it would lead to this, because it's the emotion that you're trying to calm. And sometimes reflective listening will let them vent. And remember, empathy absorbs tension. Your reflective listening would be, so let me see if I understand what you're saying, try and make that connection with the kid that he's feeling heard and he's feeling understood. That will begin to de-escalate the situation right there. For the assessment phase, interview family members. Obviously, they're part of it. If it's a domestic call, they will be a source of information. So don't leave out the other primary sources of information as you're de-escalating an adolescent. Explain what you are doing and the possible consequences. Again, this is forecasting, but it's really, really critical with adolescents. It's kind of the no surprises rule. Because adolescents can de-escalate and escalate quickly, once you've engaged to get calmness and you've decided on your course of action and you don't explain it, you may risk another emotional tantrum coming up. If you're telling them they have to go down to the hospital, or you're going to get them in touch with the judge, if you will, you need to let them know what the next steps are. Encourage your praising. Explain to youth what you need from them as you're working with them. Obviously, that works a little bit better than giving orders. This isn't really different than our previous discussion about the use of command and control with special populations, where the use of authority to get compliance works with adults, but with special populations, and now we're talking about adolescents as a special population, working with the adolescent through encouraging and praising, even if you're getting small steps from them, that will get you farther than just trying to give orders for the adolescent. And look for signs of cutting, look for signs of drug use. Obviously, your powers of observation, your situational awareness will tell you a lot in terms of what's on the coffee table, or if you're in the kid's bedroom, in terms of what to look for. For the resolution phase, if they remain out of control, again, the goal is to calm, but you are the authority figure. You won't always be able to calm every situation you're involved in, so you still need to lead it to a resolution. You do that by forecasting, and if they remain out of control, you could be gentle but firm. You could set the limits. You can let them know what you can tolerate and what you can't. Listen, you got to quit yelling at me. I'm trying to help you. I'm trying to understand, but I'm going to need you to give me your ears for a little bit so I could talk to you, or I'm going to need you not to yell at me. That I statement and the I need is what you need for the resolution. Keep pushing on that. If they're still escalating it, that's when you just need to start being more of the authoritative figure. Remind if you're still not getting what you want, and then start to warn with what the consequences will be. Look, if I can't get you to quit yelling, I'm going to have to remove you outside to the car, and we're going to have to try and talk out there. Or just be very, very clear on what the consequences are that the youth will experience if they're remaining out of control. Talk to the family if you're seeing signs of other family dysfunction, parental drug use. Let the family know of what community resources are available for them as well. And don't get into, an argument with the kid, or there's nothing we could do, or don't help the parents parent by kind of just saying they need a good lecturing or they need a good discipline, because that only can escalate the situation, and maybe throw the parents in there as well. So in closing, police officers are unique in a very unique position to make lasting change, to make things better within a crisis situation. Desperate parents can be guided to appropriate community services by a knowledgeable officer, and a sensitive intervention by a police officer can be a reassuring influence on a struggling family. As a peace officer, you are a change agent in a lot of ways, especially when you're working with adolescents and families. Thank you.